Hello dentist, how are you today? Today we're going to talk about the side effects of steroids. Before we start our topic today, I want you to subscribe to my channel and hit the notification bell for more videos. So let's start our topic today. So what are the major side effects of steroids? So what are we going to do? We're going to mention the systems that may be affected and examples of each. Okay, so for example, here we have the first system is the gastrointestinal system. The side effects of steroids on this gastrointestinal system, these steroids will lead to peptic ulceration, dyspepsia, esophageal candidal infection. Dyspepsia means that it's a discomfort or pain in the upper abdomen, and its symptoms are bloating, discomfort, and nausea. Okay, this is called dyspepsia. The next system is the musculoskeletal system. So the side effects of steroids on this musculoskeletal system: proximal myopathy, osteoporosis, vertebral and long bone fractures. Okay, so what is proximal myopathy? It is a symmetrical weakness of proximal upper or lower limbs. Okay, the third system here we have the endocrine system, and the steroids affect this endocrine, which and leads to adrenal suppression, Cushing's syndrome, hirsutism, weight gain, increased appetite, increased susceptibility to infection. The next system is the psychiatric, affects the mood and the mood changes and depression and euphoria. The effect of steroids on the eye it will lead to glaucoma and increased intraocular pressure. The effect of steroids on skin, it will lead to skin atrophy or telangiectasia, bruising, and acne. Okay, the next thing we're going to talk about is the oral conditions for which a patient may be prescribed topical steroids. Okay, so topical steroids are used for the following diseases, like recurrent abscess ulcer, lichen planus. Okay, can you see here? We have here, this is topical steroid is used are used for recurrent abscess ulcer. This is an ulcer. This is how it looks like, and here we have, this is a lichen planus. So we give, in case of lichen planus and recurrent abscess ulcer, we give topical steroids. Okay, finally we're going to talk about systemic steroids. They are used for the following diseases, such as Bell's palsy, giant cell arthritis, pemphigoid, pemphigus, sarcoidosis. Can you look at the pictures here now? Here, this is Bell's palsy. Can you see there is a shifting of the mouth upwards? Okay, this is a picture of a patient having giant cell arthritis, and this is a patient with sarcoidosis. Okay, this is sarcoidosis, giant cell arthritis, Bell's palsy. And finally, we're going to talk about pemphigoid and pemphigus, and we're going to say the difference. So here we talked about the head and neck conditions for which a patient may be prescribed systemic steroids. Okay, so here we named head and neck conditions for which a patient may be prescribed systemic steroids. So this is pemphigus and pemphigoid. Okay, So pemphigus affects the outer skin. So we have here, this is the pemphigus. Can you see here? This. It affects the outer skin of the epidermis, causes the lesions and blisters that are easily ruptured, while pemphigoid affects a lower layer of the skin between the epidermis and the dermis, creating a tense blisters that do not break easily. Sometimes pemphigoid may look like hives or eczema without blisters. So can you see they look like hives without blisters? Okay, here we have blisters. Okay, so this is the difference between pemphigoid and pemphigus. Again, the pemphigus affects the outer skin. The pemphigus, this one, affects the outer skin, which is the epidermis, and causes lesions and blisters. Okay, it causes lesions and blisters that are easily ruptured. Can you see? Pemphigoid on the opposite side affects a lower layer of the skin between the epidermis and the dermis, creating tense blisters that do not break easily. Sometimes pemphigoid may look like hives or eczema without blisters. Okay, I hope today's topic was of benefit to you. And if you have any questions, please write them down. And please subscribe to my channel and hit the notification bell for more videos.